Hello, my name is Helena Gaspar, and today I will be talking to you about the effectiveness of community treatment orders, or CTOs. Now, in order to cover this topic, we must ask ourselves, what is mental illness? According to the Australian Government Department of Health, mental illness is something that affects a person's thinking, feeling, behaviour, and interaction with other people. Now, due to mental health being as important as physical health, we must ask ourselves, how is mental illness treated? The most common ways include singular or a combination of medication, cognitive therapies, behavioural therapies, psychosocial support, and psychiatric rehabilitation. Now, due to this study, which covers the effectiveness of the community treatment orders, we must define what a community treatment order is. According to the Victorian Mental Health Act in 2014, Section 52, Subsection 1, Parts A and B, a treatment order is an order made by the tribunal that enables a person who is subject to a treatment order to be compulsorily treated in the community or taken to and detained and treated in a designated mental health service. Now that we know what a community treatment order is, it's time to ask the main question: how effective are CTOs or community treatment orders? CTO effectiveness has been researched on a global scale. When researching CTO effectiveness, predominantly using data from randomized controlled trials, or RCTs, is normally used. According to O'Reilly, RCT data is considered the gold standard as a measure of community treatment order effectiveness. Now, in order to cover CTO effectiveness, we must look at previous research. Ingrid, Mohert and Harvey in 2009 examined CTO effectiveness for patients with schizophrenia with medication as a form of treatment for that particular mental illness. Their study involved a CTO group and a control group. They found that CTO patients had halved the aggressive behaviour over their control group when compared. On the other hand, Ragasa, who looked at the evidence of CTO effectiveness on an international scale, she and/or he found that despite all of the current research being conducted on CTO effectiveness, CTOs produce no evidence of patient benefits. Now to examine another study. In 2013, Kisley and other researchers completed an 11-year evaluation of the effect of community treatment orders on the use of mental health services. They used all various kinds of data. This study found that CTO implementation reduced hospital stays by 5 days over the control group, which did not have a CTO implemented. In 2014, Kisley performed a meta-analysis of CTO data and had come to the conclusion that CTOs had no significant impact in the reduction of hospital readmission. Now, we've covered the background information on CTO effectiveness, mental health, how mental health is treated, and also examined some studies which have contradicted one another. Now, in order to conclude, we can say that CTO effectiveness has both been found to be effective and non-effective in the treatment of mental illness. Due to CTO effectiveness being studied on a global scale and mainly focusing on medication as a form of mental illness treatment and the reduction of hospital stays and readmission, Future research should look at more perspectives, such as ethics of community treatment orders and or CTOs, and also other forms of mental illness treatment. Thank you so much for listening to my presentation, and these are the references I have used whilst researching this video. Thanks again.